Lift this up as high as you can. Good. Hold this one for me. Oh yeah. Hold that for me. That's it right there. Exhale.
That hurts.
Yeah.
Like
Yeah.
a beep.
It's just a warm up.
Ah! Yeah, that is a key spot.
That's definitely better. Remember, you couldn't hold that?
Yep.
Lift up. Hold. See how much stronger that is?
Yep.
Let's go face up.
Okay. That was amazing.
Yeah.
You're amazing.
Oh, thank you. Well, none of it really matters until we get rid of this pain. I'm just gonna warm this up with this here. Yeah.
All right.
Let's see. Sometimes when it's cold. Oh, there we go. Yeah. Little hypervolt action. You ready? Have you ever tried one of these before?
No.
You need to get one of these. You ready? I got the bullet attachment on there too.
Sweet.
Because I know your pain tolerance. Let's turn it up a little bit. I feel like this is, it's just gonna kind of numb out the skin a little bit.
Yeah.
Let's try a little TFL. Woo! Oh yeah.
So it's really interesting. I had my Pilates yesterday,
Yeah.
and my guy literally had me basically do what you were saying, what's it called, the Bohemian deadlift or something?
Oh, yeah, the Russian deadlift.
Russian deadlift.
Yeah, nice. Two legs,
And-
one leg?
One leg.
Okay.
But what's fascinating, and I was like, I have to tell Josh, is that instead of just having the leg rest behind me, he actually had me push the leg into a box so that I would engage. Because if I didn't
leg that's up in
push
the air?
it, yes.
Okay.
Because if I didn't push,
Mhm.
I then grabbed from other places, and I had the massive curve in my back.
Yes.
And
Yeah.
but if it required me to push, it was really interesting. And then he had me squeezing a massive ball. In fact, I have a video of it I can show you.
Okay.
I made him take a video to show you.
Yeah.
And go down. And then he had me twist. Ah! But I thought it was so interesting because you guys are right on the same.
Mhm.
Ah! Ah! Sorry.
That's okay.
That's a bad spot.
Where do you feel that?
Right
Right
where
there?
your elbow's digging into
Okay.
my whatever that
My
is.
bony elbow.
Horrible. What is
Yeah.
that thing?
It's my arm.
No, on me. Like a tiny bit lower, it's even worse. Not that I should tell you that. Oh,
Well,
yeah, that.
rectus femoris. So one of the middle quad muscles, but the only quad muscle that's a hip flexor. Crosses two joints. And then a little bit of adductors, which we're gonna focus more on. Yeah.
Oh, that's gonna be horrible.
There's no like, this always works for 100% of people. It's
Right.
like, let's find your pattern.
Right.
This is loosening up.
Yeah. I can feel that.
Just means that we can go deeper,
Yeah.
go to the next
Right.
level. Yeah.
Those are so tight.
So tight.
It's funny because everyone who's done anything, oh, your quads are so tight, but
Yeah.
no one's ever really worked.
Like this. Yeah.
No one's worked on this quad ever, I think.
Shadle's table, baby.
Yeah?
Oh yeah, right there.
Yeah, that's horrible.
Pull your heel, so straighten your leg for me. Pull your heel down into the table like you're contracting your hamstring. Good. Keep pulling it into the table, contract the hamstring. Good, keep going. Keep going. Good. Deep breath for me. Good, deep breath. Good. Bigger, slower, deeper breath. Pull the heel down into the table. Good. We're just trying to engage the opposite muscles. Take the pressure off the hip flexors. Good. Excellent. Doing great. Good. Relax the leg. So now we're gonna try a little more adductors, because this rectus femoris is a little looser, but it's still not great.
Yeah,
So.
no. Oh God.
Adductors.
This is gonna be bad.
These are really short and tight.
These are really bad.
Now again, when we think about reciprocal inhibition, the adductors, AD,
Yeah.
as in dog, the opposite of adductors is what?
Your abductors.
Your abba,
Yeah.
with the B as in boy.
Boy.
Your hip
Yeah.
is an adductor. So reciprocal inhibition means loosen adductors, abductors will let go.
Oh,
These
interesting.
these are probably having an issue because not only your flexors really bound up, but your adductors are really bound up. Why are the adductors really bound up? Well, your hip is really high.
Right.
Your hip is really high. That's going to cause the adductors to be short and tight.
Tight.
What do we want to do? We want to loosen short and tight muscles to make sure that stretch weakened muscles work better
Right.
and contract.
So if I will constantly be like, okay, my adductor is so weak.
Mm-hmm.
So then I'll get on that machine where you
Yeah.
squeeze, you know, the no machine.
Yeah.
And profound,
Yeah. Groin. Feel
bad,
groin?
really bad.
Yeah.
Yeah, that's like the worst of everything you've done today.
Thank you.
Yeah. Are profoundly weaker than my abductors.
Okay.
So when I go
Yeah.
out,
Mm-hmm.
you know, easily, I don't know what the weight is, but double the weight of
Okay.
in. And then every time I get and do the adductors,
Mm-hmm.
then I start having issues.
Yeah.
Because then the hips get off, it messes with my pubic bone.
Yeah.
It
I'm gonna
causes-
guess you're talking about that machine.
Yeah, the thing where you sit,
Yeah.
yeah,
Yeah.
doesn't
it's,
work.
It's an awkward machine. Press your leg out like you're doing that machine. Press out. Press out. Press out. Good. 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 Bigger breaths. Bigger. Slower. Come on. Good. Big breath. Blow it all out. Yeah. Good. Press. Come on. Relax.
Oh my God. Oh my
Starting
God.
to feel gummy now.
Yeah, I feel something moving in there. For the first time in 46 years.
Yep. Come back to this here, little trigger point.
Oh yeah.
See if we can get this to release here.
This is 46 years of bound tightness.
Yeah. Think heavy. You're heavy. Be heavy. Sink into the table. Let it go. Just pain. It's nothing. I mean, you had kids.
And that was easy.
What?
Because
Oh, this is worse.
No drugs.
I'm never gonna get any clients again. I've had clients
Yeah, no,
tell me
it's-
that I'm worse than pregnancy.
Oh, really?
How bad is that?
No, it's bad. It feels like a new leg.
I like the sound of that. Would that normally
Yeah,
hurt?
that's insane.
Yeah.
Yes.
Yeah. All right, keep foot here. Don't let me pull. Don't let me pull. Remember how weak that was?
Yep.
Couldn't even hold that.
Yeah, no, just even you putting it in that position.
Feels better.
Oh my God, before it was the most insane
Pinchy.
pinching in there.
Yeah, your hip
All the
flexors
time pinching.
are locked down. You know, these would be areas that unfortunately hardly any body worker or
Correct.
practitioner ever does, which
Correct.
is ridiculous.
Correct. Drives me crazy because I have a lot of issues going on in this area.
You and probably everyone else. Yeah. But you for sure, no doubt.
Yeah.
Yeah.
Ah!
Woo!
Ah!
Good. You're doing a great job. That's Priscilla's.
Hi. She's like the annoying aunt
Yes.
at Thanksgiving.
Yeah. Priscilla's.
Ah! That's really bad.
Yeah.
Ah!
You're doing awesome. Almost done.
Can I reach you?
Yeah, there you go. Yeah, you can hit me in the arm there. Yeah. You might hurt your hand though. These arms are like steel, baby. No, they're not. Okay, let's reach for the toes and see if that feels any better.
I have to actually come up?
You don't have to do that. You can, yeah. But we'll work on that.
It's better.
It's better?
Way better. Woo! Way better. Like crazy.
How much better?
A lot. A lot better. Yeah, like before the pain. I mean, I still feel it.
Yeah, you still feel it. Yeah, yeah. I mean, if we can
It's
make you
more
feel
like
better
a
in one session, that's a great
Oh
sign.
my God.
Yeah.
No, insane.
Yeah.
Let me try this, because this is my other thing. Yeah, see, that one just lights that whole thing up.
You feel that in the hip as well? You're flattening the back now when you do that.
That's what they say to do that.
So stick your butt out even more.
Ugh, worse. The more I stick my butt out, the more it's all the way from this like bone,
Mm-hmm.
all the way up.
Mm-hmm. Yeah, your erectors.
This whole, and then that lights up the nerve in my quad.
Does that feel like?
Down
more.
further down and out towards my hip more.
That's all erectors.
Yeah, that. And then right, yeah, that. Ah, that.
Go face down. Hike your hip up for me. Hike it up. Good. Back down. Hike it up. Back down. Good. Good. Back down. Good. Keep doing that for me. Right there. I can feel that.
Yeah. That is.
Yeah, that's the pain.
That's the pain.
Yeah. But how do we keep it there? We're going to keep it there by breaking down those hip flexors and adductors. And we didn't even get to all the adductors, but this is what we're going to do. You're right-handed?
Yes. I do it a lot with my left side though.
Okay.
That is terrible. That is recreating everything I'm talking about.
Okay, face up. Go back to the same stretch, bend forward. First do this knees locked and tell me if it's worse.
Knees locked.
Yeah, reach for your toes. Tell me if the back feels worse or it still feels better.
No, it's still better.
Okay, now do the one that really hurt it with your knees.
This guy.
Yeah, yep. And flatten the back.
It's better.
Yeah.
It's definitely better. It's still not good. It definitely lights up the nerve in the front of my quad.
The hypertonicity that you have in the muscles, that's what you want to get rid of. So
Okay.
foam roll,
Yep.
lacrosse ball. You feel
Yep.
comfortable with doing that on the
Yeah,
front?
yeah.
Okay, pretty
Yeah.
much just humping the ground.
Yeah.
Okay.
Yep. Got it.
You know, there are knockoffs. I can't recommend any other gun, and this is the one that I personally use. I'm not like sponsored by them or anything like
Right.
that. But you know, if you're sitting, you know, or you're like, you know, watching some TV, you know, Queen's Gambit or something.
That was great. I watched it twice.
Yeah, you just find a good spot.
I do not to myself. Woo! Okay.
But hamstring strengthening,
Okay.
big time.
Give
I
me
would just-
one or two that you like. I mean, the ball,
Yeah.
like on my back with a fit ball and.
Yeah, fit ball, that'd be great. So, yeah, so
Those-
hamstring curls,
I do.
hamstring machine.
Yep.
You know, like
Do you like the one where you're on your belly this way or the one where you're sitting like that?
belly.
Yeah, I agree.
Lots of
Okay.
reps,
Yeah.
really slow.
One leg at a time?
You can do one leg at a time. That's
Okay.
good. Yeah, and really focusing on the eccentric, right?
Yeah.
So
Yep. So up faster, down slow.
up
Yeah.
fast, down slow.
Yeah.
Yep. You feel like it was helpful?
Profoundly.
You want to tell them it
Yes,
was helpful?
insane.
Okay.